Good morning, student. Today's topic of discussion is the lacrimal apparatus and the eyelid. In this first class, I will introduce you this lacrimal apparatus. You know, this lacrimal apparatus is an apparatus for the secretion of tear and carrying it into the nasal cavity. The total tear volume is approximately 7 microliter and it is distributed within the precorneal tear film and along upper and the lower marginal tear strip. The precorneal tear film, it moistens the cornea, it provides some nutrition, some gaseous material to this cornea. Along with this, the upper and the lower marginal tear strip, it is located in this superior and the inferior conjunctival fornices. Okay. It is a diagram. It shows this. It is a diagram. It shows this part. This is the lacrimal sac. From this sac through tear goes towards this medial canthus of the eye. Then from this pair canaliculi it goes to this lacrimal sac, and from this lacrimal sac it goes towards this nasal cavity. Again, it's a diagram. Here you can clearly find this. This is the lacrimal gland. This is the lacrimal duct. This is the conjunctival sac. It is a superior lacrimal punctum and the inferior lacrimal punctum. This is the opening through which the tear it enters the canaliculi. This is the lacrimal canaliculi, upper and the lower, and there is one also common canaliculi. From this is the lacrimal sac, and from the lacrimal sac it goes to the inferior meatus, below the inferior meatus of this nasal cavity. And here we will find one muscle. It is this is the levator palpebrae superioris muscle. It divides the gland, and this part is the palpebral part and this is the orbital part. Okay, nasolacrimal duct, and from this the tear from this lacrimal gland it goes to the lacrimal duct, then the conjunctival sac, then lacrimal punctum, lacrimal canaliculi, and then lacrimal sac. From lacrimal sac it goes downwards to the nasolacrimal duct and this inferior meatus of the nose. Okay, go to the next slide. Then part of this lacrimal gland, a part of the lacrimal apparatus, the part of this lacrimal apparatus. The lacrimal apparatus, it consists of the lacrimal gland with duct, lacrimal canaliculi, lacrimal sac, and the nasolacrimal duct. Mainly there are 4 components in this lacrimal apparatus. You may also add the conjunctival sac with this because after removing the tear from the gland, lacrimal gland, it goes to the superior fornix, and from the fornix it travels to the medial canthus. Okay. Then at first come to the lacrimal gland. Lacrimal gland, it is situated in the lacrimal fossa inside the orbit on the medial side of the zygomatic process of the frontal bone. It secretes lacrimal fluid which is alkaline. The gland is divided in its anterior aspect by the lateral horn of aponeurosis of the levator muscle into 2 parts. So it is divided into 2 parts. One is the superior part and one is the inferior part. The superior part, it lies above the muscle, and the inferior part, it lies below the muscle. The part which lies above the muscle, it is known as the orbital part of this gland, and the part which lies below the aponeurosis of the levator palpebrae superioris, it is known as the palpebral part of this lacrimal gland. Okay. The part above the muscle or the orbital part of the gland, it is connected with the periosteum of the orbit by the fibrous stand, and the palpebral part of this gland which lies inferior to the levator palpebrae superioris, it lies in the superlateral part of the eyelid, and it is smaller than the orbital part, and it lies between the conjunctiva and the palpebral fossa, and it is adherent to the conjunctiva. These two parts of the gland are continuous around the lateral margin of the levator palpebrae superioris. So it is continuous at the lateral margin of the levator palpebrae superioris. And the lacrimal gland is drained by a series of 8 to 12 small ducts. For the 8 to 12 small duct, lacrimal gland is drained into this superior part of this conjunctival sac. This run beneath the conjunctiva and open into the lateral part of the superior conjunctival fornix. And ducts open into the lateral part of the superior conjunctival fornix. 1 to 2 ducts also open into the lateral part of the inferior fornix. Since all the ducts pass through the palpebral part of the gland, therefore excision of the palpebral part alone amount to excision of the entire gland as far as the secretory function of the gland is concerned. So if the palpebral part is removed, all the lacrimal duct is abolished. So the lacrimal gland is become non-functional, and the secretion from the gland is spread over the surface of the eye by the action of the lids spreader. The blood supply of the lacrimal gland. The main lacrimal gland is supplied by the lacrimal artery, a branch of the ophthalmic artery. Sometimes a branch of the transverse facial artery may also supply the gland. The lacrimal veins draining the gland join the ophthalmic vein. Okay. Then come to the lymphatic drainage. It is along the conjunctival drainage into the preauricular lymph node. Nerve supply. The sensory supply, it is provided by the lacrimal branch of the ophthalmic nerve. Lacrimal branch of the ophthalmic nerve. Fifth cranial. And sympathetic nerve supply comes from the carotid plexus of the cervical sympathetics, and secretomotor fibers are derived from the superior salivary nucleus. And fibers start from the superior salivary nucleus, run along the facial nerve, then the greater superficial petrosal nerve to pterygoid canal, and then spatioparietal ganglia. And the post-ganglionic fiber travel as follows: along the orbital branch of the ganglia to the lacrimal gland, along the zygomatic nerve, zygomatico-temporal nerve, communication with the lacrimal nerve to the lacrimal gland, and sympathetic along the blood vessels, again from this carotid plexus. Then come to the lacrimal drainage system. The lacrimal drainage system, it comprises of puncta. The small round to oval orifices of 0 to 1 mm in diameter, situated on the summit of an elevation, the papilla lacrimalis, that lies near the medial end of the eyelid margin at the junction of its ciliated and non-ciliated part. The puncta, being avascular, is paler than its surrounding structure. The puncta are surrounded by a ring of dense fibrous tissue which keeps them patent. So puncta come to this part. These are the puncta, this and this, which lies around this medial canthus, and it is always patent by some fibrous strands. Okay. And the puncta, being avascular is paler than its surrounding structure. Then come to the canaliculi. So the puncta, it is continuous with the canaliculi, a pair of canaliculi. It is a hollow tube of 0.5 mm in diameter, connecting the puncta to the lacrimal sac. And on one of each eyelid, called the superior and the inferior puncta, and the superior and the inferior canaliculi also. Then it has vertical part 2 mm length and horizontal part 8 to 10 mm length. Upper canaliculi is slightly shorter than the lower. And there is a dilatation at the junction of these two parts called the ampulla, where the two canaliculi joins, and it is known as the ampulla. These two canaliculi it join and forms a common trunk. It is called ampulla. And this mucous membrane, it is lined by stratified squamous epithelium placed on a basement membrane. A layer of striped muscle fiber which is continuous with the lacrimal part of the orbicularis oculi near the lacrimal puncta. The fibers are arranged circularly and act as a sphincter. The submuscle fiber of the orbicularis oculi, it acts as a sphincter. Okay. Then come to this. The canaliculi unite at an angle of 25 degree to form a common canaliculus 0.5 mm in length. The common canaliculus is directed at an angle of 45 degree with the sac before entering it. So it forms an acute angle when it goes to the lacrimal sac, and due to the acute angle, some part of the mucous membrane of this lacrimal sac act as a valve, and this valve is known as the valve of Rosenmuller. The point of entry of common canaliculus into the lacrimal sac is called the lacrimal sinus of Meyer, and the canalicula are lined by stratified squamous epithelium. Then come to the lacrimal sac. Lacrimal sac, it is the upper dilated part of the nasolacrimal duct, and dimension 12 to 15 mm in length, 4 to 6 mm anteroposteriorly, and 2 to 3 mm wide. It lodges in a fossa formed by the lacrimal bone in front of the crest and frontal process of the maxilla behind the lacrimal crest. It is bounded laterally by the lacrimal fossa, and safe. Its upper closed end is flattened from side to side, but its lower end is rounded and is continuous with the nasolacrimal duct. So again we go to this picture, nasolacrimal duct. The lacrimal sac, this is the closed end and this is the open end. It continues as the nasolacrimal duct. Okay. And this lacrimal sac, it consists of the fibroelastic coat lined internally by the mucous membrane and lined by the columnar epithelium. The arterial supply of this lacrimal sac, the medial palpebral branch of the ophthalmic artery and the inferior palpebral branch of the medial palpebral artery anastomosis with a twig of the facial artery supply to the lacrimal sac comes from this anastomosis. Then come to the nasolacrimal duct. It is the continuation of the lacrimal sac. From the lacrimal sac, the continuation goes downwards. It is divided into two parts: an interosseous part 12.5 mm and an intermeatal part 5.5 mm. The opening of the nasolacrimal duct has a mucosal fold, the valve of Hasner, which prevents air from entering the lacrimal sac on sudden blowing the nose. The valve of Hasner, it prevents to get air entry into the lacrimal sac during sudden blowing of the nose. Actually, it lies in an osseous canal. The interosseous part lies in the osseous canal formed by the maxilla descending process of the lacrimal bone and the lacrimal process of the inferior nasal concha. The lining membrane of this, the mucous membrane with columnar epithelium ciliated in places, and mucous membrane forms a fold just above its end. This fold acts like an incomplete valve. It is known as the lacrimal fold or plica lacrimalis, called the valve of Hasner. Blood supply similar to the lacrimal sac. Arterial supply to the lacrimal process is derived from the superior, the inferior palpebral artery, branches of ophthalmic artery, angular branch of the facial artery, and the infraorbital artery, and the nasal branch of sphenoid artery. Venous drainage occurs into the angular vein and infraorbital vein from above and into the nasal vein from below. Lymphatics drain into the submandibular and the deep cervical gland. Then come to the nerve supply of this gland, nerve supply of this apparatus. The sensory nerve supply to the lacrimal sac and nasolacrimal duct comes from the infratrochlear nerve and the anterior superior alveolar nerve. Probably there is a reflex relation between the nerve supply of the lacrimal gland and the lacrimal sac, because extirpation of the latter greatly diminishes the tear production. It is the lacrimal pump system. How the tear, it comes to the nasolacrimal duct and goes to the nasal cavity. In a normal condition, the tear, after producing from this lateral aspect of this eye, superlateral aspect of the eye, it goes downwards and then to the medial canthus. From the medial canthus, the tear, it enters the punctum and go to the superior, the inferior canalicula, and a small amount ultimately goes to the lacrimal sac. But when the eyelid is closed, when we blink, this eyelid is closed, then what happened? This puncta and this superior, the inferior canaliculi, it empty their content, empty the tear into the lacrimal sac by the pump operating system. How is this? Because when the eyelid close, it downs this lower and also the above canaliculus, so it goes somehow downwards, and it's downwards. When it goes, then it emptied into the content into the lacrimal sac. Then again, if we open our eyelid, we open our eyes, then what happened? This puncta, it produces this canalicula, it produces forces upon the lacrimal sac, and the content of the lacrimal sac, it goes downwards towards the nasal cavity. Okay, the lacrimal pump system. And it is the lacrimation reflex, it is arc, lacrimation reflex arc. This lacrimation reflex arc is situated in by irritation of the is stimulated by the irritation of the conjunctiva and cornea, which elicit a large increase in tear volume. And the afferent limb, okay, this afferent limb, this is the higher center, and this is the afferent limb and the lacrimal gland. So what happened? The afferent limb, the reflex involve branches of the ophthalmic nerve with an additional contribution from the infraorbital nerve if the conjunctiva of the lower eyelid is involved. So this part is mainly formed by the ophthalmic nerve when the receptors of the corneal conjunctiva is irritated or stimulated. So what happened then? Impulses enters the brain and spread by interneurons to activate parasympathetic neurons in the superior salivatory nucleus, which is associated with the facial nerve, and sympathetic neurons in the upper thoracic spinal cord. The efferent pathway to the lacrimal gland involves the greater petrosal nerve. From this region, the efferent pathway comes from the greater petrosal nerve, which carries preganglionic parasympathetic secretomotor fiber and to the deep petrosal nerve, greater petrosal and deep petrosal nerve, and convey postganglionic sympathetic fiber. The parasympathetic fibers relay in the pre-pterygopalatine ganglion, and sympathetic fibers pass through the ganglion without synapsing. Lacrimation may also occur in response to the emotional trigger. Then it comes to the higher center. From the higher center, it again stimulates this pathway, efferent pathway, and the lacrimation may occur. Okay, that's all. Thank you for your listening, and the next class there will be eyelid. Okay, thank you very much.